Hello, everyone. My name is Tim Close. I'm actually a retired firefighter paramedic. I am a member of the Ohio Association of Professional Firefighters. And I want to tell you, Senate Bill 5 is devastating to the public and to firefighters. 1/3 of firefighters have lost their right to be represented by a bargaining unit in Ohio. 1/3. We have lost our right to bargain for safety equipment for us, for the most up-to-date and most modern fire gear. We have lost our right to bargain for training that we need, the most modern and up-to-date training. And most importantly, and this is what affects the public, we have lost the right to negotiate for manpower, and that is the number of firefighters on a fire truck. There is recognized throughout the country that there are a minimum number of firefighters that are needed on every fire truck to accomplish the job that they are assigned to do. And if you drop under that number, it reduces the chances of rescuing someone who is trapped in a fire. For every person that is not on that fire truck, the percentage drop is very, very high, and the chances of being saved go down to almost zero. It also increases the chances of firefighters being hurt. The fewer firefighters that are there, the more jobs they have to do, the more work, and the more likely they are to be injured. So I can tell you this, if once this is repealed, it's going to do wonders to help restore public safety. I can tell you, I am retired because I was injured in the line of duty, and I had to retire early. I broke my back was broken and my neck was broken when I fell from a roof, and I can tell you now, when as a retiree, I'll talk to you about our pension fund a little bit. I pay for my health care through my pension, and for the governor and the legislators who don't think that we pay enough for our health care, I can tell you every month I pay 60% of my pension money every month just for health care. That means I only get 40% of my pension to live on every month. And the legislature and the governor want us to pay more as retirees. So we could end up in the position where my pension that I get every month may not be enough to cover my health insurance costs, and I would have to write a check to my pension fund every month to make up the difference just so I could have health care. One other thing, for those of you who are interested in health care, your firefighter paramedics by default in our country are the first line medical providers for a lot of the 99%. A lot of the 99% can't go see a doctor when they need help, so they rely on us to help them and to treat them so that they have a chance of getting well if they are injured in some way. And we have seen this increase. We are there on the front line And we have seen what the lack of health care does to the 99%. It is devastating to people, to children especially, to women. It is unfair disproportionately. Those of you who support universal coverage, let me say, we need to think a little stronger than we have been. And what we need to adopt in this country is a national health service. We need a program that provides that the hospitals are owned by the people, that the doctors and the nurses and the technicians and the janitors are public employees who work for the people. We don't need for-profit insurance companies taking public money and administering it and making a profit off of it and trying to cover through insurance policies every man, woman, and child in this country. These programs work in virtually every Western industrialized country in the world. In 1948, the United Kingdom established their National Health Service. That was the model for Europe. France has a National Health Service just like it. Germany, Italy, Greece, Sweden, Norway, Denmark, Holland, Belgium, Australia, New Zealand. We talk about Canada all the time. Let me tell you, the Canadian system covers everyone, but it is probably the weakest because what it does is it takes public tax dollars and gives those to insurance companies who then administer individual policies on every Canadian. And that system really, even though it does protect everyone, it still provides a for-profit incentive in the system that when you have a National Health Service, when the people in the hospitals and the doctors work for you, that profit is out of there, and every dollar that's spent goes to health care. That is really, really important. One last thing. A gentleman named Adam Smith wrote a book in 1776. The book is called The Wealth of Nations. That book is recognized by economists, by business professors, by CEOs as the Bible of capitalism. And that book says that greed is the engine of capitalism. And it says that greed is good. Now, that is the basis of capitalism, greed. And I will say to you that every religion on this planet, Judaism, Christianity, Islam, Buddhism, Hinduism, and Taoism, all hold greed to be a mortal sin. It is something to be avoided at all costs, and it is something to be fought. So I will say to you here, remember this, capitalism is evil, and evil cannot be regulated. Evil must be destroyed, and it must be replaced with something good for everyone, and that is democracy, true democracy, and that's what we need to work for. Thank you very much, and remember, vote no on 2.